Yes, good morning, Representative Davidson. I am a nurse, and what I want you to understand is that we educate all of our patients. We continue to educate. And the most important thing that we understand is that it is repetition that gets people to understand what we're trying for them to understand. And the most important thing goes back to the very basis of what all of us are as human beings, and that is to love our neighbor. And when we love our neighbor, we wear a mask because we are trying to protect them. So we put in place for to get rid of secondhand smoke in restaurants and things like that, but yet we can't put in place the very simple thing of wearing a mask, washing our hands, and taking care of our neighbor as we take care of all of the patients that come to us. It's the very basis of what makes us human beings.
Well, thank you for being a nurse, and thank you for, the things you're doing to help care for others. And look, I mean, you can't say it better. Love your neighbor as yourself. The only one greater is to love the Lord your God with all your heart, soul, mind, and strength. If you do those two things, our country would be in great shape on a lot of fronts. But, kind of your premise is people aren't doing these things, but the reality is they are. I mean, overwhelmingly, people are wearing masks. People's hygiene practices have improved. I'm not sure everybody's diet's improved over this stretch. Personally, I'm up a few pounds, pretty good amount. But, the premise that people aren't doing these things, I think, is the faulty one. People do have it. Now, there are people that question it, and I think when you put things out that don't fit with well-supported arguments, that's where you kind of stretch it. And so, when people say that, the explanation of how and why a mask is effective by, preventing, the particles from leaving your mouth and decreasing that, people understand it. But when you say, well, but the virus, well, when a virus does come in contact with these masks, the masks themselves overwhelmingly say they don't actually stop virus particles. So people are pointing to grains of pieces that are both accurate and saying, to what extent does it do it? And broadly, the public has bought into the idea that, yeah, I'm happy to wear a mask in some settings. But then when you look at, for example, even with all of the PPE, and you're a nurse, some hospitals and doctors' offices won't allow family members to see one another. I talked with a grandma who's a constituent of mine and has a 3-year-old granddaughter. She was undergoing diagnosis and treatment for what they considered cancer, but only one parent was allowed in the room. They're willing to wear whatever level of PPE. And so that's where it's like, if the PPE works, then why aren't you allowing families to be together? Whether that's in the emergency room, doctor's procedures, you have women going into labor where the husband can't stay in for delivery of his child, no matter what kind of level of PPE you're wearing. And so I think that's something that the medical community could really do a good job. So I sent letters to every hospital in our district, every health network in our district, and I've put pressure on the VA. Please reconsider your policies. And it's undermining the support for requirements like wearing PPE when even in whatever level people are willing to use it, they're not able to still interact with their family members.
Let me share a headline or story actually from Erin Mehta, who tweets out from Defense News. Her